show me whereabouts your pain is, please.
So here, and it goes down to my toes and tingling.
Starting where exactly?
Sometimes it's here, in the lower back.
Yes.
But most of all it's hit down this top part of my leg.
I see. How long has that been going on now?
For about 2 months.
2 months. It first started as pain in
Pain.
in the back.
And I had no pain in my leg, it was just lower back pain.
I see.
And then I had physio, and then all of a sudden it just started to go down my leg.
Down the leg. Was there any benefit from the physio that you had?
The back pain reduced, but the leg then started to hurt.
And then since then, what course of action did you take after that?
I continued with physio, and then one day I couldn't get out of bed, so I went back to the doctor.
Yes.
And she recommended I have an MRI scan.
Yes.
And then that came back and said about my slip disc, and said don't go to physio because it might make it worse.
Mm.
And then I went to see a spine specialist, and he said I have to have the operation on my lower back.
I see. And obviously you're not taking that. What prompted you to then?
So I wanted a second opinion because I didn't want to have the operation, so that's when I came here.
I see. And we're just about to start. Is it quite understandable? Has it been made clear to you where the problem is and what exactly is going on? And then from your inference, what is happening? What's going on?
What's happening?
Yeah, well, what's the problem?
So I've got 2 discs that have slipped, and it's caused a trapped nerve in my leg, and it's given me sciatica.
I see. And how's this affecting you?
So I can't sit down properly for a long period of time, have trouble sleeping at night, just pain all through the day normally. So I have to get up, have a walk around, but it's still numb.
Yes.
And I get pins and needles, which I can't, that just comes and goes.
Are you taking any pain control medication? Tramadol at the moment. How is that? Is that helping?
No, not really.
No.
And anti-inflammatory tablets, I don't know what they're called.
Yes.
It's
Not really touching
exactly the same pain.
Really? Okay. Well, step by step, let's get through it. Just indicate the area where you feel the discomfort, when you get it.
Yeah, so it starts from like here
Yeah.
and goes down the back of the leg here. That's where the most pain is.
So at this stage, if you can just talk about what you're noticing. Is the pain level, is it the same as before? Is it more? Is it less? Can you just talk me through?
So before I came here, I had the pain mostly every day, throughout the day. So I'd have to keep walking around just to sort of shake it off.
Yeah.
But now it comes and goes, but it's worse at night. So going when I'm laid down for a long period of time.
So that when you're lying at night
Yeah.
now, it comes on, all right?
Yeah.
And so are there periods where there's zero pain? When there's no pain?
Yeah, it does when I fall asleep, and then when I wake up, sometimes there's pain, sometimes not.
Okay.
So it's just random.
Are you feeling pain as we speak right now?
No.
No? So while you're at work and during the daytime, you're saying there's no pain?
No, there's not really, no.
Okay.
It's just numb.
All right, some numbness, huh? And is that different from before? I mean, you were saying you were not able to go into work sometimes,
Yeah,
weren't you?
sometimes I couldn't even get out of bed in the morning. I had to call in sick because the pain was really, really bad. So I've not had that since.
So you've not had that since you've started, right? And do you see that as a positive sign?
Yeah, definitely.
So, great. You're saying when you go to sleep, after how long at night does it start to kick in?
About 20 minutes after laying down, and it goes numb, pins and needles, and it starts to ache. It's like an aching pain at the back.
I see. Does the pain wake you up from sleep
Yeah.
at the moment, yeah? So are you waking every night at the moment?
Most nights, yeah.
Most nights, huh? And how often are you taking the medication at the moment?
Every day. I'll stop taking it in the daytime,
Okay.
just at night before I go to sleep, and if I wake up with pain, I'll take more.
I see. So and when you do get the pain, is that pain level the same as it was before we met?
Yeah.
So it's that same pain level, and now you're noticing that it's affecting you only at night,
Yeah,
right now.
at night.
All right. Okay. Good.
It would hurt. I don't have that anymore, and I'd get it every night and every morning. Now it's only sometimes 3 times a week, 3 or 4 times a week.
So whereas
it's not as bad as what it was at all.
I see. So again, the percentage-wise you're saying is
70%.
70% less compared to before. Now, whereas this was a daily occurrence at night, you're not getting that, only 3 to 4 nights maximum of the week. When you do feel the pain, I remember before you said it would reach up to a level of 10 out of 10, didn't it? Yeah. Now what do you, now at worst, what would you give it?
2, 3.
That's
and I don't have to take any painkillers, where before I was taking about 4 tramadol a day.
4 tramadols a day, huh? And now, when was the last time you took tramadol?
2 weeks ago.
2 weeks ago. So last 2 weeks there's been no need for any painkillers, no messing.
Not taking any painkillers.
Wow, very good, very good. When before we were talking about the pain, it would be coming down the leg. If you just show me the direction where it was going from the buttock.
Stop at the knee, always on the back.
Yes. Whereas before it was going
all the way down to my toe.
All the way to the toe, wasn't it? Yeah. So you've not had that going anymore. Before you mentioned lower back pain as well. How was your lower back pain?
No lower back pain.
Okay.
That's gone completely.
Wow. And how does that make you feel? How is positive
Yeah.
sign? One issue was as well that we talked about it was when you were sitting either at the desk or in the taxi.
Yeah. So at work I don't feel it. In the back of taxis I'm fine now. So yeah, I can sit down properly now without it hurting.
Yes. Yeah. Good. Any when we first met, you were quite tense and nervous and.
Yeah, I didn't want to have this operation. So it feels like it's definitely going, and I think hopefully a few more sessions it'll be gone.
Sure. You mentioned that you were concerned because that's something you'd been advised, right? You'd been advised surgery. You didn't want to do that. No. So if somebody else was here and then they were feeling a pain like this and they'd been told surgery, what would you advise someone like that?
I'd recommend them to get a second opinion and try this before they had spinal operation.
Okay. And I know everything's not tip top. There is still a condition there. We've seen from our X-ray evaluation that there's an issue there in the spine. But knowing that, how is your confidence now compared to? Before you were worried about surgery. How do you feel now? Do you feel confident?
Much better. Yeah, I feel confident that it's going to go.
Good, step by step. And what about your homework? What about exercises?
Yeah, I've been keeping that up, doing all my different exercises.
Weird and wonderful movements. Yeah. How do you feel that combination of the treatment here and the exercise, how do you feel for yourself that works together?
Yeah, I think it is definitely working because every time it's getting better. So it must be working.
Good. Excellent. Good.